TurboFort is a drug-free respiratory device designed to assist in expanding and clearing the lungs and airway of excess mucus, phlegm, and other foreign materials like dust, pollutants, and bacteria. It is a very simple and effective drug-free handheld device which uses two simple processes to help clear the lungs. The first stage is called the mucus loosening and mobilization process, and assists in loosening and mobilizing any mucus or materials which may reduce the airflow into and out of your lungs. The second stage is called the mucus elimination process, and assists in helping you to remove the mucus and materials from your airway by combining TurboFort with induced coughing or the Huff maneuver. Stage 1. The mucus loosening and mobilization process. 1. Gather a glass of water, tissues, and a container to cough into. Relax, and assume either a standing or sitting upright posture and position. 2. Take a slow, deep breath into your lungs, to the point beyond a normal breath, but do not fill lungs completely. 3. Hold breath for 2 to 3 seconds. 4. Place the TurboFort mouthpiece into your mouth like this. Breathe into the TurboFort device at a reasonably fast but not too forceful speed using abdominal breathing. Abdominal breathing is deep breathing from the abdomen. Quite a number of people breathe taking a shallow breath from the upper chest. 5. Adjust the device by tilting it until you feel the maximum vibration within the chest, keeping your cheeks stiff. 6. Exhale beyond a normal breath, but do not empty lungs completely. 7. Attempt to suppress any coughing. And 8. Repeat these steps for 5 to 10 breaths. Stage 2. The mucus elimination process. 1. Breathe in slowly, filling lungs completely. 2. Hold breath for 2 to 3 seconds. 3. Place the TurboFort mouthpiece into your mouth like this. Breathe forcefully into the TurboFort device as completely as possible. 4. Adjust the device by tilting it until you feel the maximum of vibrations within the chest as before. 5. Repeat these steps for 1 to 2 breaths. 6. Initiate a cough or huff maneuver. Repeat the elimination step sequences, stages 1 and 2, until lungs are clear or therapy is over. And 7. Additional sessions may be added if necessary. How TurboFort works. The TurboFort device uses a natural method called positive expiratory pressure, or PEP for short. This process causes a vibration of air in your lungs, also known as a flutter effect. The process assists to loosen obstructions in the lungs, like mucus or phlegm buildup. This pressure also assists to force these obstructions out of the lungs and airways to make you cough it up. As a result of using the TurboFort, it will assist in helping to clean your airway and improve your lung capacity. Because TurboFort is drug-free and all-natural, children as young as 1 year old can use the device under supervision and can be pulled apart and cleaned for multiple uses. What can TurboFort be used for? The TurboFort device can be used to assist with the management of most respiratory conditions which cause a buildup of mucus, phlegm, or foreign materials in the airway. Some of these conditions include COPD, emphysema, cystic fibrosis, bronchitis, even the common chest cold or flu. What shouldn't you use the device for? You should consult your doctor before using TurboFort, but TurboFort should not be used for people with conditions where the lung tissue is damaged or you have bleeding in the lungs. Some of these conditions include tuberculosis or conditions where you are coughing up blood or lung tissue is damaged or bleeding. Pneumothorax, which is where the lungs are uncoupling from the chest wall due to air or fluid buildup on the outside of the lungs, usually from a stabbing wound. Right-sided heart failure, is where the right side of the heart is not pumping blood to the lungs as effectively as normal. For more information about TurboFort, go to our website www.theturbofort.com or email our team at info@theturbofort.com.